I wanted to share some slides actually that I must give credit to Alexa for having shared them with me from her other section. And although I did a few revisions to things, essentially this is the information that comes from her. And most of the information that she's using in these slides comes from two different textbooks, neither of which are assigned in this course, but you may have been familiar with from other courses. One is Techniques and Guidelines for Social Work Practice by Schieffer and Uracy, and the other is the Social Work Skills Workbook by Barry Cornoyer. Both of these are actually out in more recent editions since the time that these slides were put together, but the essential content here remains the same. This is very useful information and is something, again, that is presented to you in addition to the information that you're getting in the Morrison text as far as working with clients are concerned. The plan change process is a professional effort that helps clients bring about desired changes that are intentional and that are planned. The basic premise is you start where the client is, and of course there's a long process you go through in determining just where the client is and what kinds of things the client is willing to work on and how the client perceives the problem. This change process is of course completed in collaboration with the client throughout. The 6 phases of the plan change process include preparation, where you set the tone and set the general direction of all the other interactions you're going to have with the client. This requires that you be personally and professionally ready to engage with your client. In the intake and engagement process phase, you begin the relationship, you identify and define the client's concerns or problems, and also you may need to determine the client's eligibility for services, although oftentimes this is done before the client comes to you. In the data collection and assessments phase, you're gathering information and studying the problem or situation, making some decisions in concert with the client about what it is that needs to change, what can be changed, how it can be changed, and so on. When planning and contracting, you're formulating objectives, evaluating the possible strategies that you might take to obtain the objectives. You agree on an intervention plan, that is, who's going to do what, and then you determine the time by which these goals and these objectives should be completed by making use of these strategies. During the intervention monitoring phase, this is actually when you're providing the professional interventions that we've been studying about all semester. You're carrying out the plan, monitoring the client's progress, revising the plan if necessary, if the desired results aren't being achieved or not being achieved within the time frame that is necessary. This is something that I think you might want to clarify with the client before you begin providing services, which is that the plan, whether it's a case plan or an intervention plan or a treatment plan, whatever you want to call it, that plan is a living document that is subject to revision and updating as time goes along. Finally, you close with a final evaluation and a termination process that engages the client and yourself in evaluating the overall progress and hopefully brings a positive end to the relationship, getting feedback for the agency about how services and programs might be improved, and also for yourself in terms of how your own interventions might be improved as well. Now a little bit about each of these 6 phases. In the preparation phase, much of this work actually occurs before you meet the client, and this involves looking over the client paperwork, any existing client records or screening information you may have, notes from other workers, and so on. You might obtain pertinent information from others before the meeting, and you might also consult with your supervisor or a colleague as you begin to learn about the nature of the problem that's going to be addressed. You set up the logistical arrangements for the meeting, that is, where is the meeting going to occur and when, and perhaps assisting the client in finding ways to get to the meeting with you if necessary. And spend a little bit of time thinking about what the client's subjective experience may be in terms of seeking services from your agency, particularly if you work for an agency where there is a fair amount of stigma associated with individuals who receive services there. You might also begin to prepare by exploring some of your own thoughts and feelings about the upcoming interaction and organizing your thoughts and feelings and those kinds of things. And finally, preparatory planning and recording, where you identify a tentative general purpose for the interview, that is what you hope to achieve in the first interview, and you make notes for a preliminary outline for the interview if you need to do that. Think about what the client might feel in this situation. What do you assume, that is, what the client may be thinking? Is the client anxious? The client worries about being judged, about whether they'll get the help that they need? Will they be treated with respect? Will they be embarrassed or ashamed because of the information they reveal? And it's best, I think, going into this to assume that the client's had bad experiences and You want to make sure that you're the one that provides them with a positive experience, it may be for the first time. How's your office set up? Take a look at the office arrangement and be sure it's as comfortable as possible and as welcoming as possible. Ask yourself what your office says about the client as far as how the client may feel he or she is perceived. Is it a personal setting? Is it a professional setting? Is it comfortable? Do they have some reasonable assurance of confidentiality because of the arrangements that you have available to you? In many agency settings these days, workers are being given cubicles to work in rather than private offices, and providing confidential interactions is becoming a little more complicated than it once was. And in those situations, generally speaking, clients are afforded interview rooms where you can sit down with the client, although it's something that you're going to have less control over in terms of making it comfortable and reflective of who you are. Look at what you wear and whether or not you're on time. Make sure you're on time for the client. That communicates a lot of respect to the client, and be sure that you're able to pay attention to them. If you have issues going on in your daily living, do your best to set that aside before you begin to sit down with the client so that you're fully present. And be aware that your expressions, your body language, the things that you wear, how you prepare yourself, all communicate something about yourself to the client and also reflects how you feel about the client and how much respect you have for that individual. In the intake and engagement phase, you're going to put the client at ease and begin establishing trust. You demonstrate a genuine interest and concern for the client's presenting problem, for the request they have, for the situation that they're in. You tune into the client for this. You want to work to show unconditional positive regard and not be judgmental, and to demonstrate some trustworthiness in what you do. And this is something you'll want to do throughout your interactions, of course. Ask your client what they would like to be called. Ask what name they prefer, what pronoun they prefer, those kinds of things as well. Sometimes it's better for clients to start with small talk and chit-chat. In fact, with some clients, maybe younger clients, you spend a little bit more time doing this than you might with adults or other individuals who are coming to treatment on their own accord. Involuntary clients sometimes need a lot of extra work in putting them at ease. Whether or not you use small talk or not, be sure if you do that it's appropriate, and then move on to the purpose of the contact with the client. Don't rush the client. Don't rush the plan. Be there and be present and be ready to take the time that's needed for them to tell you their story. Good rule of thumb, talk less, listen more. Help the client clarify and articulate their requests or concerns if they have difficulty doing that. Mostly open-ended questions are best at this stage of the process. And if you don't know when a client asks you a question or you're unclear on something the client is saying to you, tell them that and find out and try to straighten out the lack of understanding. If you're going to take notes, in some situations you have to do that in the first contacts. Be sure you discuss that with the client and let them know you'll be taking notes. And understand also that the client may ask to see your notes, and you should always be ready to show them to the client. So you don't want to scroll anything inappropriate in the notes that might reflect a lack of respect for the client or a lack of awareness about the situation that they're dealing with. As you go along in your treatment relationship, perhaps you'll have to take fewer notes. Sometimes agencies will also use recordings of the initial interview so that you are relieved of the need to take notes. But if you do that, be sure that the client is fully aware that the interview is being recorded, either audio or video or both. There are all sorts of unspoken client questions that you should listen for, and perhaps these are some things that you might use in your reflecting and empathizing as you go through the initial phases of your contact with clients. Things like worry that there's something wrong with me, or did I do something wrong? Or am I crazy? Am I hopeless? What are you going to expect of me? Will you make me feel bad, or will you judge me? What are you going to do? What kinds of things are going to happen? Is this even going to be of any use to me at all? And will you be able to understand me? All those kinds of questions are things that may be going through the client's mind as they respond to different questions and prompts that you provide them during your initial contacts with them. Keeping this in mind, perhaps you can put the client at ease. In the intake and engagement phase, there are certain factors to consider, including what the presenting request is, what the past experiences the client has had with helping systems. If they've been negative, again, that's going to impact the client's willingness and ability to be comfortable with you at this phase in your relationship. What are the precipitating events? Usually when clients come to us, they have been dealing with issues for quite some time, but something's happened that brought them to you at this present time. And it's useful to find out what that was, because that tells you something about what is really important in the client's life that would motivate them to seek help or to follow through with help. What are the current stressors in the client's life as well? The more you know about current stressors, the more you'll be able to provide some concrete help in the early phases of treatment as well. And of course, we must be aware of all the cultural and demographic factors which come into play in the client's life, all those systems of oppression that are acting in the client's life, and to listen very closely for indications of that in your interactions with them. Given the client's history of helping systems and this group, what would a person feel about you as their social worker? What is the meaning of receiving services, and what kind of stigma is associated with receiving services from that agency? All these kinds of things are factors which need to be considered as you start your relationship with the client. In the data collection and assessment phase, you're gathering information by not only speaking with the client, but also talking to other people as well, caregivers and other significant individuals in that person's life. If you're working with a minor, that might be parents, for instance. Also reviewing any relevant records. You're making observations, and you're also, of course, conducting interviews, and sometimes you have standardized measures and tests and tools available to you for assessment purposes as well in this phase. This is all intended to help determine what is happening and to give you a clear picture about the client and the client's life. So in this process, then, you should complete gathering information before moving to assessment and planning as much as possible. Acknowledge clients' issues in this process and determine the client's priorities. This is very important to know as you go about setting up a meaningful treatment plan for the client. You should understand and attend to the client's primary area of concern, because showing an interest in that will help the client to be more motivated to engage in the process with you. The client will specify a problem, and while you may not necessarily agree with that being the primary issue, nonetheless, it's important for you to make note of that and acknowledge that as you also identify some areas that perhaps the client isn't identifying that also is worthy of assessment. Find out when the problems began, how often they occur, how long they've lasted, those kinds of things, and also, of course, look for client strengths and engage in problem solving as much as possible with the client, making use of those strengths. Oftentimes at this phase also, you'll have the opportunity to complete a biopsychosocial history as well. There are different techniques to use in this data collection process, and just to mention a few of them here, the use of open-ended, non-directive questions as much as possible is very indicated. In some types of positions, you are going to be required to focus more upon directed questions and closed-ended questions at times, but if at all possible, even in a forensic interview, a good technique is to start with broader open-ended questions and narrow it down little by little to eventually become more closed-ended questions if you have to do that in order to engage the client in providing the information you need. But the more open-ended question you have, the more spontaneous the client's response is going to be, of course, and the more information you're likely to gather. In the responses to those open-ended questions, oftentimes you're going to get new material, and so you want to listen for that and follow that lead as well in your exploration with clients. Provide feedback and comments to clients in the process as much as possible. Follow up on answers to the client's questions as much as you can, and use reflective listening, those encouragers, paraphrasing, reflections of feelings, and those kinds of things that we've seen with other experts in the field and the various techniques that we've read about and we've watched in our videos. At the end of the contact, it's always useful to summarize what you've gone over and what you see as key points. Ask the client if they have anything they want to add to that, and provide supportive responses throughout. Silence is also something, as we've mentioned earlier in the semester, that can be very powerful and can be useful in your interactions with the clients as well. During the data collection phase, the social worker, in collaboration with the client, is making sense of information that has emerged so that their collaboration can occur usefully in order for the problems, issues, and needs to be addressed. You identify the urgency of addressing the problems as well. There are certain areas that perhaps need attention first, such as substance abuse use, threats of self-harm, or threats of self to others. These are things which need to be dealt with quite immediately. So this is always something you want to look at in early phases of a treatment relationship. Always be aware of personal and situational factors. That's the person and environment framework that we're so very familiar with as well. And understand, again, the situation, the context often impacts the client's problem. And so always assess the context of the problem to get a full understanding of the client's behaviors. Develop your own hypothesis about how issues of concern will be addressed, and then also share that with the client and collaborate with the client, determining their own hypothesis, and then draw upon the strengths and resources with the client and in the client's system in order to address the problems. So during this phase, you're clarifying issues for your intervention and identifying issues that the client must deal with, organizing descriptive information, you're sharing your hypothesis with the client and listening to the client's hypothesis of the problem as well, and preparing a tentative assessment and case formulation. During the planning and contracting phase, this follows integrally from the exploring and assessment processes and leads to the development of a service agreement or contract between the worker and the client. So here we're identifying the nature of the problems and what our goals are, what it is that we intend to do about that problem, and then begin to develop different kinds of strategies in order to address that problem and to achieve the goals that are identified. There is one format for addressing goals, the SMART format that is suggested here. I think that's in the Kornoyer workbook. Goals be specific, measurable, action-oriented, realistic, and timely. Specific so that the client does indeed know what is being addressed in that treatment plan. You and the client both have an agreement about that. That it's measurable so that you can tell whether or not progress is being made. Action-oriented, that is, each person, including yourself perhaps, have things to do in order to achieve that particular goal. It's realistic, something that is achievable and is actually, if at all possible in the early phases, very likely to be successful. The client's likely to be successful with it. We find that if clients experience early success in interventions, they're more likely to continue to work on the more difficult aspects of their intervention later on. And so give the clients a goal that is realistic and is something that they can experience some success with early in this process. And also that it's timely as well, that it's achieved within a certain amount of time that is a reasonable amount of time, and the client again can see some success in their efforts. This is essentially how a treatment plan is set up and identifies who, what, when, where, why, and how in the process of treatment. Another important part of this process, of course, is evaluation, and we have to evaluate the client's progress toward the resolution of the problem and achievement of goals. And you do this periodically, and if necessary, then you adjust goals and fine-tune them. You might roll back and set up more steps in order to achieve the goal rather than big steps towards the goal achievement so that the client, again, can experience some success along the way. You might find out that it's no longer necessary to concentrate on a particular goal, that in essence the success has been achieved, and you can move on to other areas. So periodically, you should always evaluate progress and see how things are going. And then summarizing the contract in this process is important. It's a concise review of the issues for the work, that is the goals and action plans and tasks that the client and you are going to engage in the process of working towards resolution of the problem. Usually these things are written, of course, treatment plans, case plans, and so on. If you're a private provider, your insurance company is going to oftentimes want to see those plans. The intervention and monitoring phase follows the planning phase, of course, and this is where you move from collecting information, establishing your relationship, and forming an assessment and negotiating the service contract. And now that all that has been achieved, then the client, or rather the social worker, begins to use his or her skills to promote change within various aspects of the person issue situation. This requires that the social worker express a professional agenda, as well as thoughts, feelings, beliefs, opinions, hypotheses, deductions, conclusions, not all at once, but along the way in your working with the client. All of these kinds of things are going to come into play, and you'll be sharing these with the client. There are different kinds of skills and techniques that are often called upon during the course of intervention, such as rehearsing action steps like role plays and those kinds of things, reviewing action steps, that is to process with the client what happened when the client has made an effort to carry out the tasks in real life, evaluating, again, reviewing the progress towards goal attainment, helping to keep the client's attention focused upon the work at hand, educating when there is knowledge that you have that might help the client understand a little bit more about what's going on, sometimes advising if the client is willing to accept, but also allowing the client to reject any advising that you give them. And again, advice giving is something that is a little controversial in the field and probably should be reserved for specific kinds of situations. Sometimes you want to act on behalf of your clients. You represent the client in the community or with significant others, that sort of an advocacy role. Sometimes you might have to stop the process if you begin to see difficulty in your interactions or lack of progress, and check out your relationship with your client and your client's experience and interactions with you and your work together, because there may be some things binding things up there on that level. Something that you'll do frequently is what we call reframing, where you take a situation the client sees very negatively and to find a way to introduce a new way for the client to perceive that situation or to perceive themselves. It's called reframing. Sometimes you have to confront the client, again, not in a jackhammer kind of way, but in a way that the client can incorporate and integrate what you're saying to the client. Be sure the client always knows that this is not an ongoing permanent fixture in their life, that this is going to come to an end at some time, and remind the client of that if sometimes they need that in order to boost their motivation. And of course, recording, as we've talked about before, recording the process in regular case notes is something that's very vital. After all this process has gone through, it's time to look at termination and final evaluation. And there are, according to Cournoyer, at least 4 most common forms of concluding relationships with a client. One is where you transfer the client to another individual within the agency. Perhaps you're leaving the agency yourself, or there's a realignment of workloads or whatever it might be. Hopefully that doesn't happen very often, but it does happen at times. Sometimes there's a referral to another agency when it's apparent that the services that your agency or your office provides isn't what the client really needs, and to hand the client off, hopefully very carefully, with another professional. Oftentimes it's good for you to consult with that other professional and the client in the transfer process, if at all possible. Do that all together. Termination is, of course, another way of terminating, where it is that you have either reached the length of time that you're permitted to work on a problem or further work is no longer needed. Now, hopefully with termination, you can leave the door open for the client to come back. There is some discussion that says that it sometimes is better for clients to not really believe the door is open, so to speak, that, it kind of helps them make the break from the treatment relationship to know that this is it, we're done now. But in most cases, I think it's good to leave the door open for client to come back to you at different times for fine-tuning and that kind of thing. I've seen that with younger clients in particular over the years, where they go through different periods of times, and there's a number of different reasons for this. Something going on in their life might stir up their issues again from, say, earlier in their childhood, and to know that at that time the parent can bring them back in, or the client can come back in and do a series of brief treatment episodes, perhaps, in order to make the adjustment again and go back out into the world, so to speak. That's something that is really not uncommon in outpatient therapy. And of course, we do see this also in our child protection caseloads at times, as one example, in substance abuse treatment. You and your client openly discuss the ending process and hopefully jointly determine the best course of action under the circumstances. But there is another common way of concluding relationships with clients, and that is where the client discontinues services for whatever reason. And oftentimes the client just kind of fades out and stops coming. And that's a reflection on the fact perhaps that either your goals were too grand for the client, or there was something in the nature of the relationship that was creating problems for the client. There's a number of different reasons why those kinds of things happen, but we want to minimize client discontinuation without explanation as much as possible. So when you're terminating, in the first 3 phases at least, and you're anticipating termination, you want to review the process. Provide a retrospective on what's occurred between you and your client during the time that you've worked together. This is something that you do together. It's a good discussion. It isn't just your perspective, but also the client's perspective. And this is an opportunity for the client to give you feedback on your interventions and what was useful, what might have been less than useful. Then you begin an evaluation, perhaps, where you refer to the tools and measurements that you've used that maybe provide some objective kinds of evaluations of progress, but also you and the client share subjective impressions. Check in with the client about their view of progress, share your own view of the client's progress and what you see. Share your feelings and say goodbye. Again, within the professional boundaries, these, of course, would be appropriate feelings, but encourage the client to share their thoughts and feelings about the ending of the working relationship, and share your own feelings that are appropriate as well. And then finally, recording the closing summary might be called a discharge summary in some cases, closing summary in others, whatever it might be. But again, you should have a written document that closes out the services and provides a summary of the services that were provided and the progress that was determined to have occurred. And so that's really it as far as the plan change process is concerned. Is this little bit of additional information might have provided you with a few other things to think about along the process. These slides come from information provided in these two textbooks. Again, there are more current editions of this textbook out now, but they're essentially the same. Again, of course, thanks to Alexa for providing the primary basis for these slides to me. Let me know if there's any questions, and we'll be talking about this as the semester goes along.